So tell us viewers at home a little bit about hyperpigmentation. What actually is it? What actually causes it?
Hyperpigmentation are the dark patches that form on Asian and African skins predominantly.
Yeah.
So they tend to happen from lots of different causes. Say, for example, you get them on the cheeks as you grow older from sun damage. You also get them after acne or any type of spots. You get them post eczema or any other form of inflammation on the skin.
And also like hormones as well.
Hormones can contribute as well, absolutely. So you tend to get it during pregnancy, for example.
Is that something called like the pregnancy mask that I hear about?
That's
Some
absolutely
people that have
right.
different colorations on their skins and stuff when they get pregnant.
That's absolutely right. Usually with pregnancy mask, it does tend to fade. Some people are left with it a couple of years later, and those are the ones who come in to get treatment.
And what kind of treatment do you do here?
Well, we basically specialise in hyperpigmentation treatments for skin of colour.
Okay.
So we're a very specialist centre. Now, the way our treatment works, well, let me tell you a little bit about hyperpigmentation and what's actually happening to the skin.
Yeah.
When you get hyperpigmentation, it means that the cells that produce the pigment melanin become hyperactive and they start to produce too much pigment. What we do in the clinic is we calm down those hyperactive cells and we bring them back to normal.
Right, okay.
The way it works is first we give the client a cream that prepares the skin. They apply that every night for 3 weeks. They stop for a week, then they come in for the treatment. The treatment is a clear gel mask. There's no pain, no redness, no irritation. It's just warm on the skin. Then they go home with it on. They leave it on for 8 hours and they wash it off, and we give them creams to wear for the next 8 weeks.
Right, okay.
And results basically seen at the end of those 8 weeks.
So they're only coming for that one time then, and then they obviously have the home maintenance for 8 weeks afterwards.
That's right. One treatment gives about a 50% reduction in hyperpigmentation.
Okay.
So a lot of people are very happy with that, and they'll just do one treatment. Other people are looking to get the skin as clear as possible, so they'll tend to go for more than one treatment.
So you can come back if you want to get it even clearer.
Absolutely, yes.
So you're kind of like undoing the work that's already been done with the melanin?
Yes. So those hyperactive melanocytes that become triggered from inflammation and damage, we're calming those down and bringing them back to normal.
So what about those kind of laser treatments that I've heard of that actually gets rid of hyperpigmentation? Is that true? Does it actually work?
Basically what it is, there are a couple of other very common treatments for hyperpigmentation. So there are things like laser, glycolic acid peels and TCA peels. Now all three of those treatments can burn the skin. And in skin of colour, if it burns, it pigments further.
Yes.
So you've got to be so careful with what you put on skin of colour. So that's why we're very different. With our treatment, you physically can't burn, and so you don't get those side effects that you can get with other treatments.
Yeah, because I do actually know somebody who's actually burnt from getting skin removal, like hair removal, laser basically.
Right.
So this will kind of like undo any kind of damage like that.
Exactly.
So what can people do at home then to kind of like minimise any chances of getting hyperpigmentation? I'm assuming kind of SPF and stuff like that?
Absolutely. Basically what it is you want to prevent the damage in the first place. And the most common form of hyperpigmentation happens after sun damage, so UV damage.
Okay.
So really from a very young age, anyone's skin of colour really should be wearing high SPF, SPF50.
Yeah.
I think there's a common misconception that SPF should be worn mainly for Caucasian skin. The reasons for wearing SPF 50 for skin of colour is for hyperpigmentation. So in order to protect yourself, you really should be doing that from a young age.
And for premature wrinkling as well.
Absolutely.
I always use SPF 50.
Absolutely.
But most people think SPF even 15 is okay, because sometimes you get that in creams and you think that's enough, but it's actually not.
It's really not. It's very, very minimal coverage.
So what makes your treatment here different to other salons that actually do the treatments?
Well, here we're a very specialist centre, so it's very difficult to compare because generally everything else that's available is for Caucasian skin.
Yeah.
Now, Asian skin, the pigmentation is darker and it's more resistant. In addition, the skin is more sensitive because if it burns, it pigments further. So the treatments that you put on Caucasian skin are really not suitable for skin of colour.
Yeah, of course.
So that's why it's very different.
So you touched on the treatment. Should we take a look and see exactly what you do?
Absolutely.